or landmark, which will allow the AG investigators to properly identify the establishment. You're also urged to identify the product, be as descriptive as possible. Details such as brand, size, fluid ounces, pounds, number of loads, and product type, bleach, wipes, detergent is also important. And, of course, take a photo. Get your phone out, take a picture of the item in question and the advertised price. That's the important part. Make sure you get the price. And then you email all of this information to consumerprotection@oagguam.org.
All right, so I wanted to bring Margaret Hattori Uchima on the phone. She is not only the Dean of Nursing at the University of Guam, but she also does some great work with the homeless. I guess, Miss Margaret, if we could first just start on the nursing side. We wanted to get some tips, so maybe some FAQs about self-quarantine, home isolation, just maybe some ground rules, because we've seen some stuff from the CDC, but how seriously do people need to take the self-quarantine measures?
Well, morning, Chris. People really need to take it seriously. I mean, I think just with the rise in the cases, I think we don't have the luxury of, keeping our head in the sand and thinking everything's okay. And the CDC website has great information on how to self-quarantine, how to home quarantine. I don't know if you've seen it.
We have.
Okay, great. That is great. It's very specific. It talks about easy things. I mean, you guys have already covered the hand washing. But there's things that, Chris, like I was telling someone earlier, my mom's 80, she's high risk. I have a 16-year-old teenager. I'm not even letting my teenager out of the house to come visit my mom in her condo. Anybody that's high risk, we need to try to protect them from the rest of us that are carrying the virus, right? And that can really go a long way to prevent that. There are seniors at home, though. I feel so bad for them because, the senior centers are closed. And some of them are calling into the hotline saying, just last night saying, I live alone. My daughter lives in another village. She can't come see me. I just want someone to talk to. I mean, that's kind of heartbreaking. But we need to maintain, the social communication. We need to maintain that part of our culture. So phone calls, if you have time, FaceTime or WhatsApp video or anything, reach out to your loved ones that are stuck at home and can't get out. And we shouldn't get out anyway, unless you're essential service that needs to go to work. But there are still some people that are, having little family barbecues and grandma's there. And, Chris, you've heard that the high risk are people with heart disease, diabetes, kidney failure. And I really pray for the family of the first person that passed. And so we know that a lot of people are high risk. I mean, probably everyone has someone in their family that's high risk, and those are the people we need to protect. So, staying at home is very important, and staying, keeping outside people that don't need to be in your house. Don't have people come over, don't have visitors. Visit from the behind the door, right? The 6 feet,
right? Yeah,
6 to 10 feet rule. The CDC does say go out, go to the beach, go to the park. I mean, it's great weather, but not party. I mean, not be close. It's okay if people are walking and they're socially distancing. That's appropriate because you don't want to go stir crazy. But remember, it's those high touch surfaces, the doorknobs, the tables, the shopping carts, right? For God's sake, it's the best time to bring your reusable bag and just put what you're buying in the bag. So it's some basic things, but I think people are just not taking it seriously. Partly, I don't know. I mean, I'm a healthcare worker. We're stressed out. We're scared. So I don't know why no one else, why regular people aren't. Because when you start seeing healthcare workers being afraid, then I think,
you should be afraid.
Yeah, Margaret, we've been talking about this since the very beginning, is that, the doctors, some nurses, they've been very consistent in their message. We're behind the curve. We need to test more people. And, they've been sounding the alarm before we even knew we were supposed to be alarmed. And let's talk about the state of our healthcare system before COVID-19. We were already maxed out. We were already in a place that we didn't want to be, and then this is only compounding things. And I want to go back to what you said about taking this social isolation order seriously.
Right. And I mean, I know it's been a long week, but prior to that, I mean, I don't know how long. It's been a while because we're, at the university, we're government of Guam nurses. Same with DOE. We've got nurses that are not in a hospital setting, and we knew that this was coming. We knew we would be activated. So, we prepared. We got fit for the respirators. I got 3 faculty at GMH. One's working in the ER. So we've been talking about this for weeks because, I mean, you saw what's happening in the States. I don't know why anyone thought it wasn't going to hit Guam.
Right.
We are a special people, but we're only human. So I think that was it. I think people, because some people were telling me, oh, yeah, it's not going to happen. And
Margaret, I think people thought that because we're an island and, there's that sense of isolation already, but yeah.
No, but also we travel more than most people. There's people in the U.S. mainland that never go to Japan, never go to the Philippines. They just drive their car to another state. But here we've got all these visitors coming in, which is great. That's a great part of our economy. It's very important, but it always puts us at risk. And you were probably here for H1N1 and SARS. And I remember the public health nurses had to go check temperatures on the planes. And people said, oh, why can't the governor stop the planes? Well, hello, we're a territory, right? We can't do that. We're in a similar situation, but much worse. But people forget that the healthcare system, people have short memories. We've been crying for help for GMH for years. This is not anything new.
Yeah.
And so we haven't bolstered that system. We've always had a nursing shortage. We have a physician shortage. We have shortages in other areas too, radiology. I mean, it's not just, it's throughout the healthcare system on Guam. But we hadn't done enough to put us in a state where we're fully capable. But I have friends working at big hospitals in San Diego, and they're running out of equipment. So so we can't be too critical of our current system. All we can do from this point, I think, is to pitch together. Recognize that everyone is doing their best. Being a leader at this time of a crisis is not, it's not an enjoyable position, I'm sure, for the governor or anybody else up there. The CDC does have excellent standards, but keep in mind, those change rapidly during a pandemic.
Right. So, Margaret, we want to ask you about this. It's kind of water under the bridge now, but the CDC guidelines that those who are positive COVID-19 patients exhibiting the low to mild symptoms, that it's okay for them to be home quarantine and isolation.
Yeah, that's a great question. And, I have to apologize, Chris. I've been working on trying to get resources out to the staff and trying to mobilize the nurses. That I'm not an expert at all on that. I know that the CDC guidelines are the gold standard, and that's what we've been following. And as the cases have been increasing so rapidly, then things have to change. I mean, remember, the only ones getting tested before were the PUIs, and the early definition of PUI was only those that traveled, right?
Right.
And then it got expanded to now, people with a fever or respiratory symptoms, and that changed so quickly. So those kind of things are very difficult for, for the hospitals and policymakers to grasp, because we have to go with those changes. I mean, someone told me today there's even changes on, how we use our PPE or how what kind of not isolation precautions, but really I think it's a matter of how we use our resources. So we're all trying to just keep on top of this and be aware as much as possible. And you're right, it's water under the bridge, but at this point, everyone has said it's community spread. And that's why we're begging people to stay home. If you have to be out, wash your hands frequently, and just really sanitize. We've closed, a lot of places are closing. I mean, my building's totally shut down. We're still trying to make sure we can graduate our current batch of nursing seniors, because we know the healthcare system's going to need them. And so we've gotten a lot of support for that. We've got some of our students helping in the call center, just the seniors, out of harm's way, but they can still do something. And Chris, any nurses out there, whether they're licensed on Guam or let's say they have a license from another country, the Board of Nursing is asking for people to contact them. We do need help, and they can help use their brain power, even if they can't go in the field, which is okay. I know people are scared.
Right.
We need help on the phone lines, to give that medical information. And I know when the whole, the bingo thing hit, right, and the call center got more calls. But public health, I know you got the numbers. Public health has that counseling hotline now, separate from the medical hotline.
Right. We're going to get that out there because I think that definitely some people are in need of someone to talk to.
Right. And the thing is, it's community-wide. We should just assume that everybody we see is infected. I know that sounds dramatic, but hello, I mean, people are
well, these are dramatic times, Margaret.
Yeah, and really, people need the support. We're all scared. The people that are out there, I mean, you talk to nurses that are on the front line, and they talk about how they have to isolate themselves, quarantine themselves. I'm working with one group, and they told me today, hey, we're not going to let you in the building anymore. You have to stay 10 feet away, and I respect that. So we're all going through this stress, and so any support to those that are out there is helpful, even if it's just moral support. Really goes a long way. I saw some of the restaurants donate food to the SNU people, and Chris, I got to tell you, I was in there that week that they were sending patients home that day, and I could feel just the stress of everybody, the staff, the patients, the families, everybody, and it was heartbreaking. But though, the healthcare system needs the support of the public, and the public needs to be informed.
Where are you?
People need to read.
Where are you stationed at? Are you roving around?
Yeah, I'm kind of roving. We've activated a nursing resource mini command post, going through the list of all the licensed nurses and the practical nurses, nursing assistants. But we've been helping with the call center. The call center is a great place for our students because it's away from the front, yet it's so vital. And a lot of our faculty and our Manumco nurses. I mean, I've got people that Facebook message me saying, I retired, but I want to help. Can I come out and help? So that's heartwarming to see those people that have been retired, providing their expertise, because the public needs someone on the phone that knows what they're talking about.
Yeah.
And so, I'm just so thankful that people are coming out that are able and willing to help.
And that's something the doctors were saying, that it's going to get worse. And so for people that have any sort of medical background or experience, who do they call to volunteer?
Okay, the Guam Board of Nurse Examiners is actually located in Hagatna. They can call, but if they already have a license, I'm so sorry, let me find you the number. And we have had some nurses, let's just all be blunt, because it's it's a pandemic. We have had nurses that have a Philippine license that didn't get a U.S. one yet, and they can get a temporary Guam license if they meet certain criteria. And the Guam board number is 735-7408 or 7409. I've got some people that are great. They know what they're doing. A colleague of mine just got a temporary Guam license. He's amazing, and he's helping staff the call center and answer calls. So there's nursing assistants that have also come forward, licensed practical nurses. But yeah, we need to mobilize everyone that's available, because this is only week one.
Yeah, Margaret, and that's kind of what I wanted to ask next, was like how much more of this can we take?
Well, Chris, the crazy thing about Guam is that, and I don't want people to take this the wrong way, because I don't want people going out because I'm going to say this. We are so resilient. I mean, people are doing it always brings out the best and the worst in people, right? But I have to say, from my perspective, I've seen a lot more of the best. I have people texting me, and night saying, what can I do to help? I have people right now getting food for nurses. All weekend, we've been trying to make sure that the people on the front, have the supplies and the food. So, it's early in the game, Chris. We got to worry about the homeless. And I met with those great ladies at the Homeless Coalition. People are on top of it. People are trying. We are resilient. We will keep, we're in a better position than some of my friends in San Diego that already ran out of equipment. I know that I heard today that Mike Cruz asked the dentist to donate some of their PPE because, of course, they're shut down. And so, we are asking for help, and people are starting to, especially after last night and the numbers coming in, people are starting to help. Now, we don't want people going on the street, so this has to be really controlled. And, there's ways you can drop off things without getting contaminated. I mean, don't go to GMH, don't go to public health centers. It needs to be arranged in a thoughtful way so that people are not contaminating each other.
So how does this work for people, like for the homeless situation, and people want to make donations? What do they need to do? They call again?
I know Salvation Army and Catholic Social Services are still, and I think you might have seen on social media that Catholic Social Service was asking for food.
Okay.
Because they do run several of the shelters.
Okay.
And Salvation Army is on skeleton crew already as well, but they have a food pantry and a warehouse. And Gura, our top person at Gura that works with the coalition, is checking to make sure the street homeless. That's who I worry about also, is the street homeless. Checking on the soup kitchens to see if they're still providing food. But making sure that our frontline people have water and food and the PPE, those, the basic things. And it's heartwarming to see that people are stepping up and helping when we've asked for help. So I think we all need to be transparent about what the healthcare system needs. I'm not one to ask for help, but, the last week, I don't care. I'm calling anybody I know saying, hey, can you donate water?
Right.
And people are pulling through. It's amazing. UOG, the president himself, has given me resources to try to help me get supplies and food or whatever's needed. So I just got to say, there are a lot of people trying to help. So I do think, I can't predict the future, Chris. I mean, I know it might be a long road ahead. That's why we're begging people, stay home, wash your hands. If you're chronically ill, now is not the time to skip your medicine. Now is the time to take it. Don't eat stupid things. Like if you're on dialysis, don't go start eating potato chips now. I mean, use common sense. Don't go doing electrical things or getting on your roof and falling, because we don't need people going to the hospital for things that are not COVID related.
Right.
And call your healthcare provider before you try to go in, because we really need to screen who's coming in now and be very careful about those resources. So if the public, which we know already is very chronically ill, we all have, we joke too much about everyone has diabetes. Now it's not really funny at all. People need to take their health seriously and take their medication, call their providers if they're having issues. And definitely those numbers, hotline number, public health is doing a good job of trying to track contacts. And remember, the public health system was also stretched very thin. I know I've heard a lot of criticism, but man, Chris, there's been nurses and staff working since before the call went out.
Of course, Margaret, and that's why we feel like they need to corral as many resources as, maybe start looking at people we said were non-essential last week. Maybe now they're essential.
And actually, I mean, they're, we're getting some staff to help us with things that are, not nursing related, so that we could focus on the nursing stuff and have someone else help with deliveries and things like that. And that's been really great. But I do think people need to read the CDC's information on self-quarantine and home isolation. I know that's one area that not enough information has gone out on. And so that would be very, very helpful if you could provide that website again.
Margaret, we're going to let you go. I know you got just a ton of things going on. And
Thank you.
Okay.
Take care.
And you call anytime you want to get the word out, or you want to chew these people out for not listening.
For everything.
Okay. Thank you, Margaret.
Stay home, people.
Okay.
Thanks.
Okay.
Bye.
Goodbye.
That CDC website is cdc.gov. And so she also says if you have any sort of medical background at all and you would like to help out, the number is 735-7408. That's 735-7408 or 7409. And that's for the Guam Board of Medical Examiners. Call, please, if you can help out in any way and you have any sort of medical background.
And, with Margaret, gosh, she wears so many hats. The two biggest ones are, of course, being the Dean of Nursing at UOG and also for her work with the Homeless Coalition.
Yeah.
And I think that's why you heard there, she's driven to tears. I mean, she's probably just thinking about...
That's a lot to think about.
I mean, it's just so much.
And
right.
healthcare.
So, hey, we're going to take a break. It's 8:37. There's a national press conference going down with President Trump. And they are talking about the territories. We had the FEMA director just announced that the territories and the Indian populations do not need to declare emergencies. And we've seen this kind of like back and forth. It's amazing in all this that our elected leaders are still finding time to write each other nasty letters.